Good evening. If you're thinking about escaping the cold and heading somewhere warm, there's a good chance you'll need a hepatitis A or B shot. The trouble is, those are hard to come by right now. There's a Canada-wide shortage with no end in sight.
We're thinking about Jamaica in June. Yeah, but I'm not sure what happens if she doesn't get that shot.
This mother has been waiting for months to get her 2-year-old both the Hep A and B shot.
I've just been calling all kinds of pharmacies, constantly calling my doctor's office. I even tried calling the States, called Buffalo, their hospital, their children's hospital, to see if they even have it, because I'm not sure what I'm supposed to do. I mean, she needs the shot and nobody has it.
Right now, the shortages are happening with little to no notice. Sometimes pharmacists have almost as little heads up as our patients. Our assumption is right now there's a lot of controls on drug prices. There's a big debate going on if we're going to go national pharmacare or if we're going to just make generics more affordable across the board.
In extreme cases, Hep A can lead to liver failure. It's spread through contaminated food or water. Hepatitis B, on the other hand, is spread through sexual contact. It can lead to a chronic infection that increases the risk of liver failure and liver cancer. Which countries would you generally need to get the Hep A vaccine for?
It's a really good question. So at least for Canadians, generally all the warm climate countries we fly out to, so your Dominican, your resorts, Cuba, that kind of thing.
According to the Government of Canada website, Africa, Asia, Central and South America are regions that are most high risk for hepatitis A. That means a lot of Canadians need the vaccine, but not everyone can get it.
We do it based on priority at this point. So who needs it for when, who's high risk, if they're elderly or have immunocompetent issues. And then we try to see, for the little that we have, how can we somehow give this to patients? What we've had to do is come up with unique solutions. For Hep B, for example, only the pediatric, the child dose is available. So we've had to give 2 of those for adults, so it makes up the equivalent of the adult dose. We're trying to come up with any solution we can right now.
Pharmacist Joseph Fanu says it's tough when you have to turn down patients because of little to no stock.
You can see if you have already immunity to it. A lot of people in Canada who grew up here have their vaccinations done in high school. So you can do a blood test and say, hey, do you know if I'm immunized for Hep A and B? And it'll come back in a couple days and tell us, and maybe you don't need it.
She loves the beach. She loves the ocean.
Rishma said, unsure of whether her daughter is going to get a tropical getaway anytime soon.
She's my kid, and I need to make sure she's protected.
We reached out to Health Canada for a comment about the shortage. They said they're working on it with various companies and authorities to address this issue. They also said they prioritize which shortages have a greater impact on Canadians. In the meantime, the pharmacist we spoke with recommends giving your local pharmacy a call as soon as you know you're traveling so they have as much notice as possible to try and fill your prescription.